Hi everyone and welcome back. This is episode 2 of the Doctors Bjorkman Have a Baby.
Well, it's actually the Doctors Bjorkman Try to Have a Baby at this point. But this is likely to be our funnest episode yet, as we're going to be talking a lot about things you could do and that we're actually doing to try to get pregnant.
So, Mom and Dad, if you're watching, this may be the point where you want to tune out because we're going to be talking a lot about sex and a list of evidence-based practices to optimize your natural fertility.
And things that all couples could be doing to get pregnant fast.
So if this is the first time you're meeting us, I'm Sarah and I'm an OBGYN.
And I'm Kurt and I'm a pediatrician.
And we are
the Doctors Bjorkman. So in case you missed it, last week we talked all about who we are and what we're doing. But if you want, we've got that video linked below for you to check out. And you can always follow us on Instagram at the Doctors Bjorkman for more insight into our day-to-day life.
Basically, we're two doctors. We waited a long time to start a family, and we thought it would be fun to document the journey from beginning to end, all 40 weeks of pregnancy.
Which makes this week, week 2, where we're going to be talking a lot about getting pregnant.
So interestingly, your chances of getting pregnant in a month are only 20 to 25%.
Yeah, but fortunately that means for most healthy couples, after 6 months, 80% of them will be pregnant. And that number rises to 85% at 12 months.
But keep in mind, infertility is a disease defined as not being able to get pregnant after 12 months of unprotected intercourse or exposure to sperm. So if it's been that long for you, it's time for you to go see your OBGYN or your REI. Reasons you should head in sooner are if you are over 35 or if you have some GYN history that puts you at a higher risk of infertility, like irregular periods or a history of some GYN surgery.
But if you're like us and you don't have any of those issues that you know about, you may be wondering, how can we get pregnant as fast as possible? Which is why we came up with this fun mnemonic about optimizing your natural fertility fast. For that, the F is optimizing fitness.
The A is avoid things that can decrease your fertility.
S is for sex.
His favorite. And then T is for timing. We're going to talk all about your fertile window.
So again, the F in the FAST mnemonic stands for optimizing overall fitness. Last week we talked a little bit about things that we thought about as a couple before making this decision to start a family of our own. Wanting to be in good health, both to get pregnant as a couple and to be parents hopefully in the near future as well.
Essentially, you don't want to weigh too much and you don't want to weigh too little. Studies have shown that obese women with a BMI over 35 can take up to twice as long to get pregnant on average, and women who are really thin or underweight with a BMI less than 19 can take up to 4 times as long to get pregnant.
So if you're not in a hurry to get pregnant, this is a great time to work to optimize your overall body weight, great time to get back in the gym, schedule regular exercise, and even clean up your diet.
That being said, there's no specific dietary variation, vegetarianism, veganism, antioxidant diet, or some herbal remedy that has been shown to improve fertility or affect baby's gender.
However, the fertility diet, which is notably rich in poultry, seafood, whole grains, fruits and vegetables, and also low in things like red meats, low in sugar, and low in other processed foods, is related to better fertility in women and better semen quality in men.
This is also a time to talk about prenatal vitamins. If you are thinking about having a baby, now is the time to start taking a prenatal vitamin with at least 400 micrograms of folic acid or vitamin B9.
As a pediatrician, this is super important to me. I've cared for multiple children with neural tube defects, and taking folate as mom before you get pregnant is one thing you can do to decrease your baby's chance of having this happen.
Yeah. And the final thing to think about here is that women's fertility starts to decline around age 35. It doesn't really catch up for men until age 50. But if you aren't quite ready to start a family, just keep this in mind when you're thinking about your goals and your plans for the future.
So during this 40-week series, we're going to be jumping in with little sections we're going to call IRL, or in real life. Because yes, we are doctors, but we're also real people. And we want you to know what the things we're talking about look like in real life.
I get asked all the time what kind of prenatal vitamin is the best, and my only recommendation is that it has at least 400 micrograms of folic acid. I'm not brand loyal in any way and didn't even have a go-to prenatal when I went to look for myself. So I picked up the first thing I found on the shelf. It's got 400 micrograms of folic acid and some DHA, and it also smells like fish and made me nauseous, so I had to look for something else. I have landed on these Ritual Essential Prenatal Vitamins. They smell like lemon. They're a little more expensive than I wanted to pay, but I am not nauseous at all. I am not sponsored. I am paying for these with my own money, and I really like them so far. Had those not worked for me, I probably would have gone to a gummy prenatal vitamin, but those do not have any iron in them, and so I'm just happy these are working for now. So the A is to avoid things that can decrease your fertility.
The short list of things we're going to cover here are smoking, alcohol, caffeine, and other toxins.
There are 1,000 reasons to quit smoking, but we know that women who smoke are more likely to experience infertility and are more likely to have a miscarriage.
And men who smoke have been found to have decreased sperm number, and their sperm have decreased motility as well.
What about alcohol?
Yeah, so alcohol is really important for us to mention here because there's no safe amount of alcohol in pregnancy for the developing baby, as alcohol is known to be detrimental to the developing fetus's brain.
That being said, when you are trying to conceive, having one drink every once in a while is probably totally fine. Studies have shown women who have 2 or more drinks per day are more likely to experience infertility, but if you have 1 or less, it's probably totally fine. You just have to stop once you are pregnant.
Which brings us to my vice, caffeine. So women who consume more than 500 milligrams of caffeine or the equivalent of 5 cups of coffee a day have increased rates of infertility, and women who are pregnant who consume 200 to 300 milligrams of caffeine or 2 to 3 cups a day of coffee or more have increased rates of miscarriage.
Correct. However, studies have shown if you have 2 cups or less, or about 200 milligrams or less of caffeine when you are pregnant or trying to conceive, there are no adverse effects on your fertility or pregnancy outcomes. So those 2 cups of coffee a day are okay. You don't have to quit.
Awesome.
One more thing to think about. Marijuana is a substance that's difficult to study. However, it has been known to cause harmful effects to the fetus and can decrease fertility. So that is another one that you probably want to cut out when you are trying to conceive and pregnant.
Yeah. And finally, a list of other substances that you should try to avoid if at all possible. Things like dry cleaning solvents, heavy metals, and pesticides have all been shown to have decreased rates of fertility in both men and women. And now time for everyone's favorite letter in this mnemonic, S for sex.
We are going to talk about some of the questions I get pretty frequently as an OBGYN and debunk some of the myths. We're going to talk about positions, orgasm, frequency, and lubes that are safe and not safe to use.
So first of all, there's no special position to help increase your chance of getting pregnant.
Correct. You do not need to lay on your back. You don't need to hold your legs in the air for hours after sex. The sperm gets to the fallopian tube in minutes to meet that egg.
So whatever position works well for you, have at it.
Yes.
But having said that, female orgasm also has no relationship to pregnancy.
However, I would highly recommend it.
The other really important thing to talk about is just how often a man should ejaculate to help improve his sperm quality.
Yep.
So we know that abstinence of 5 days or greater can decrease sperm count, and more than 10 days between ejaculation can decrease overall sperm quality.
But daily ejaculation has not been shown to decrease sperm quality or concentration. It's fine.
Yeah. And actually for men who may have low sperm count, they may see the highest sperm concentrations with daily ejaculation.
Finally, we should talk about lubricants.
Yeah. So lube is one of those things where if you're trying to get pregnant, you may be making things harder on yourself without even knowing about it.
Yeah.
There are certain lubricants that can decrease sperm motility, notably things like KY, Astroglide, even olive oil and saliva can decrease the sperm's ability to get where it needs to go.
Yes, so lubricant that is okay is going to be mineral oil, canola oil, and something that is a hydroxyethyl cellulose product.
So these are things like Pre-Seed
Yes.
or even Conceive Ease are brand name products on the market that do not inhibit sperm motility and can give you the lubrication you need if you need it.
Yes.
So again, while products like this are really popular, they can impair sperm motility, which is why we switched to Pre-Seed, which contains hydroxyethyl cellulose. We have not yet raided the pantry for other fertility-friendly things like mineral oil or canola oil. And just to make things easier on you guys, any products we've talked about today will be linked in the description below.
So we are to our last letter of the FAST mnemonic. We are at the T, and that is all about timing. We are going to talk about the times when it is best to have sex to get pregnant fast.
What we're talking about here is a period of time every month called the fertile window, which is the 6-day period ending on the day of ovulation.
And actually your highest chances to get pregnant are when you have sex on those 1 to 2 days before ovulation or the day of ovulation.
Yeah. The goal here is to have sperm there ready, waiting to meet the egg when ovulation happens.
Because the egg can only live for 12 to 24 hours after it's released, whereas sperm just doesn't die and can stay in the female reproductive tract for up to 5 days.
So we say all this not to create stress, but rather to make things more easy for you to help optimize your chances of getting pregnant.
Because predicting ovulation can actually be kind of difficult, and there are different things you can use to try to help. There are period tracker apps for your phone, there are ovulation predictor kits, there's basal body temperature monitoring, cervical mucus monitoring, different things that give you a general idea. So tracking ovulation can be difficult because it can vary from day to day, from cycle to cycle. There are different things you can do. One of them is a period tracker app. I've been using the Clue app. Again, not sponsored. I just like it. It's easy. You track your cycles for a while and then it tells you what your fertile window is based on your history. You can also use ovulation predictor kits. I have been tracking my cycles for a couple months and so have tried out a variety. There are the sticks. There are these little inserts that actually are nice. They hook into this digital monitor that gives you a digital readout. I broke my digital monitor, so I don't have that anymore. And then there are these strips. They come in like a 150 pack that they all turn. You get 2 lines when your LH is rising, which means you're gonna ovulate in the next 24 to 48 hours. There's been a lot of sending Kurt texts of like, is this 1 line or 2? Is it faint today? Is that a faint blue line? But for the most part, it seems to be working in terms of detecting my LH surge for ovulation and timing of sex. The easiest way to improve your chances though is to just have more sex. We know that pregnancy rates are highest if you have sex every day, but having sex every other day confers about the same pregnancy rate.
And this is the one thing we've promised you that all couples can be doing to get pregnant faster. That is having regular sexual intercourse, penis in vagina sex, every 1 to 2 days after the end of the female partner's period for 2 weeks. It's that easy.
That easy. Have more sex at the right time, have a baby.
So honestly, I've never felt more pressure to perform before in my life this week, which is a feeling I never thought I'd feel.
But it feels like high stakes sex.
Yeah, and so we're trying.
We're having a lot of sex and we're having a lot of fun.
And I haven't been turned down one night this week.
All right, everybody, that is a wrap on this week's episode. Just to recap our mnemonic to get pregnant fast.
With F standing for optimizing your overall fitness.
A is avoiding things that can decrease your fertility.
S, have sex.
And T is timing.
So hopefully this is helpful for you guys. I know these are the things that we're doing as we're trying to start a family of our own.
Subscribe, leave a comment, follow along, let us know if you have any questions.
Yeah, we'll be back here next week talking about the 2-week wait and what's happening in the time between having sex and actually finding out we're pregnant.
Thanks for joining us.
We are the Doctors Bjorkman. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.